What is wrong with healthcare? Why do we need healthcare reform? The simple fact is that healthcare is a very bad value for the money. Nearly 300,000 people are killed by hospital errors every 3 years. Now, in most other industries, a statistic like this would be one of or two of, but this statistic is repeated every 3 years. And you know that if you go in a hospital, you need to take somebody with you who really loves you, really loves you, and who is very assertive and intelligent to deal with these unforgivable errors that kill people. The issue, however, that brought President Obama to the table is a very serious economic issue. We spend about 16.2% of our GDP on healthcare. We compete with countries that spend about 10% of their GDP on healthcare. We spend about 60% more. It is difficult to point to commensurate 60% increases in anything else about our healthcare system. We also pay for it in unusual ways. Primarily still, we pay for it through our employer-based system. Other countries have broad-based taxes to absorb their healthcare expenses. The combination of these two facts mean that our companies, the ones that offer health insurance, have to pack their healthcare costs into the services and products that they ship abroad and compete globally on. It is a terrible battle. It's uninsured. The most rapidly rising component of the uninsured earns more than $75,000 a year. What is $75,000? It puts you in the top third of American wage earners. Why are these people uninsured? Because they're bad guys? Let's do a little math. $75,000 in my home state, Massachusetts, is $35,000. Now, $35,000 I have left. Am I going to spend $20,000 out of that to buy health insurance? No way in the world that I'm going to do it. So health insurance costs are so high that even wealthy people are uninsured. How many of you have insurance that has a $1 million a year, a $1 million lifetime maximum? How many of you have health insurance that has $2 million lifetime maximum? How many of you have not got a clue? Okay, you should start to think about this. Right next to the Harvard Business School is a building that looks like a Gothic church. It looks like a Gothic church because in the People's Republic, it can't look like what it really is, which is a pharmaceutical company. So this company is called Genzyme. Genzyme earns $1.2 billion on one drug that deals with the mutated genes that I just bored you to death with. So these mutated genes cause a disease called Gaucher's disease, which inhibits the ability to absorb fat. Where is this disease when you need it? So it's actually a very serious disease, and the fat builds up in your body and it kills you. This particular pill is not Claritin and it's not Pepcid, it's not the little purple pill. You take this pill, which corrects and deals with the mutations in your genes that inhibit your ability to absorb fat. You live. You don't take the pill, you die. Okay, this is personalized medicine. Genzyme earns $1.2 billion from this one pill. How many people take this pill? 300, pretty good. Anybody else? 4,000 people. 4,000 into 1.2 billion is $300,000 a year. If you've got $1 million lifetime maximum on your insurance policy, 3 1/3 years on this pill, you are uninsured and you are uninsurable. No insurer is dying to take on this person with a $300,000 a year sticker. Hospitals need, so we have real problems with our insurance base, even for people who have insurance. In my view, the problem with costs is that we do not have sufficient competition in healthcare. When it comes to health insurance, most employers offer a choice of one policy. When you go in your supermarket, there are 42,000 SKUs that you can look at. So a trivial thing like going into a supermarket, incredible amount of choice. Insurance, there's a choice of one policy. In many parts of the United States, hospitals have merged and they've become monopolies or oligopolies. In some parts of the United States, 80% of all hospital admissions go to one system. And if you're a physician who has an idea about how to innovate, and there are so many physicians and nurses and people in healthcare who have these ideas, I meet them all the time, you have to understand 1,400 pages of regulation known as the Stark Laws. These are named after Congressman Pete Stark, who observed that when physicians start their own facilities, they over-refer people to those facilities. That is a legitimate problem. His solution was to stop having physicians as innovators. This is akin to telling Thomas Edison that he cannot start General Electric because he might induce people to buy too many light bulbs, or telling Bill Gates that he cannot write operating systems because people might use their computers so much. So the Stark Laws is a genuine problem, very poor solution. The Stark Laws are 1,400 pages of laws. Any law is incredibly ambiguous, twice as long as the King James Bible, not half as good. So a physician who is starting to think about being an innovator has to invest at least a few $100,000 right off the block to make sure that he or she is not violating these laws. What these incredibly boring 4 lines are all about is a lack of competition in healthcare. If you don't have competition, you don't have innovation. If you don't have innovation, you don't have productivity, and that's where we are on the cost side. And that is what's causing the quality problems in healthcare. When hospitals merge, frequently quality diminishes. Why? Lack of competition. It is elemental economics and suppression of innovation.